When it comes to the helping professions, mostly what we're talking about there is burnout or vicarious trauma. So vicarious trauma is more likely to be for counsellors or psychologists who listen to traumatic events or their clients reliving those traumatic events. Most professional people will have ways to make sure that they are not getting to the point where they're not going to be able to work anymore, not going to be able to function. When it comes to, first responders, paramedics in particular, it's more likely to be something like a trauma disorder from exposure to trauma. And some people can go for years and years and be exposed to trauma after trauma and it doesn't bother them. But then it's one case, one thing that they attend that touches a nerve in them. It's really important to recognise when we have flipped over into something that's not healthy. So for a lot of anything involving children is naturally really traumatic for the people that respond, particularly if they have their own children, because that's not really, that's not the order of things. Children aren't meant to die or meant to be harmed.
Yeah.
Being able to keep track of that. If your coping mechanism is to drink a lot every night, there's a problem there. Right. Because that's not a healthy coping mechanism. And we'll always need first responders. We'll always need people that are exposed to that trauma where we have an expectation that they'll be able to cope. So it's really important that people who are choosing those careers also are choosing, how do I prioritise self-care? Not just because I'm worthy of self-care, but because I want to have a long career, and that they're able to recognise when something does affect them. And sometimes that it can just be cumulative. Nothing bothers them until everything bothers them. And to be able to recognise that. Most helping professions are fortunate in that, there is real camaraderie among colleagues, and they're able to say, no, I'm seeing things that make me concerned about you. Yeah. When it comes to students, just choosing to study is a really fantastic thing to do for yourself, and that's something that people should be proud of. But it also adds to stress. Yeah. And I know that if they're lucky enough to be an APC student, there's an entire student support staff here specifically to help with those sorts of issues. If you're not coping, can you defer? How can you cope better? What would be, you've got students from right across Australia that will go to workshops with people that they don't know to talk about confronting things. Just know that is managed in a way that recognises the importance of the student's health. But certainly if they are working full-time, then choosing to study, they're young or they're going through a transition, which quite often happens when we choose to change our career path, recognise that you're just by those choices that you're under stress. And that stress is good. Or can be good. It's getting you to somewhere that you need to go, but you need to manage that in between. And if you don't have in your personal life people that can support you in that, then you certainly have them through your college, and to take advantage of that, because that's what they're here for.
Yep.